Well, hello, I'm Doug Apple, back with another special interview for you today. It's the year 2024, and a lot of new things triggered into effect in 2024. New laws all over the country, new things involving HealthCare and health insurance. And we're going to talk about some of those things with Mike Sharman. He's the legal counsel for Share HealthCare. We're going to bring you up to date. You've been hearing the ads here on Wave 94 for Share HealthCare, the nonprofit healthcare sharing ministry. They bought a little airtime. You can find their details at sharehealthcare.com. We're going to talk a little more about that in a little bit, but let's get into some of these news headlines. And Mike Sharman, one of the big ones is the California making a big splash among their many hundreds of new laws that went into effect in California. And you said this interesting quote about California. You said, California is a socialist nation. Well, if anybody wants to see what socialism looks like, you can take a glance at what's happening in California. It seems like they've got money to burn. They're throwing out money and paying for things left and right. And yet their government's running a deficit. I don't know how it all works, but one of the things they're doing is giving out free healthcare services to illegal immigrants. And sometimes the Christians might even say, well, isn't that the kind thing to do, the loving thing to do? Well, Mike Sharman, there's a bigger picture here, and I'm going to let you talk a little bit about it and give us some of your thoughts on these new headlines coming into the new year.
Well, thanks, Doug. I guess a helpful place to start is to give a definition of socialism, because that word is bandied about a lot, and so many times we don't really understand what it means. And socialism is pretty simple to define. Karl Marx had defined it a long time ago. It's when the state, the government, controls or owns the means of production and services. So it either owns or controls the production or services. So with California, we're talking about Medi-Cal. That's the state-run, state-owned health provision program. So just by definition, that's socialism right there. And then it had been relatively narrow, but now for undocumented immigrants, otherwise, illegal immigrants, they're illegal under federal law. Now California said all of them will qualify for Medi-Cal. And what's interesting, too, is Marx had said that socialism should be brought in incrementally, step by step. Well, California had step by step brought in what they now have is that full coverage for all illegal aliens. But it began first by having, a number of years ago, first having people who qualified by, one, being a resident, having been in California for a while, and then two, by being at a certain income level. So they had that first. Then they went to children. Then in subsequent legislative years, they went to anybody over 50. So what are they now doing? Well, now all they're doing is plugging that gap between 25 and 50. Those people who are above 25 years old and under 50. So that's what they've done now. How is that not kind to the rest of Californians? Well, because it's going to cost them over $6 billion a year. And that's for the taxpayers. All right. Now, and just this year alone, supposedly they had, 300,000 illegal aliens come into California from the Mexico border in 2023 alone, just that. So imagine the premise that as a community we share in our taxation, and so we are all contributing to this same pool. Well, you have 300,000 people who just came in who never shared in that taxation. Mm-hmm. It's like essentially they're newborn babies, and newborn babies don't pay taxes, but their parents do. Well, here you don't have that either. So it's unfair to the other taxpayers. It's also unfair to those who are legally waiting to to come in, who want to come into the U.S. from whatever nation and are on the long waiting list. It's unfair to them, so it's unkind to them, it's unloving to them. Plus, as we mentioned before, when you make somebody dependent, when you just give them an unearned gift that they could have earned themselves, that debases them.
Mm-hmm.
And, there's a couple interesting things about illegal aliens. They have a much higher percentage of them that work than our citizen Americans. About 90% of illegal aliens work. And we have just, around 60 or so percent of citizens who do. So it's not that they aren't working, but because they do stay under the radar because of many different things, or they just enjoy being part of the untaxed hidden economy, they aren't, even if they've been here for a while, they're not going to be on the tax rolls because many of them are working with, under the table payments. I mean, it'd be pretty rare if any of your listeners have not known somebody who is working for under the table income. It's common.
Mm-hmm.
So that's why it's not fair and not loving to the rest of us either. But what caused this? Because remember, this was an incremental socialist movement in the area of healthcare in California. Well, what caused it is Californians stopped exercising their freedom muscle. And freedom always involves risk. Freedom always involves a cost or a sacrifice, so to speak. But you have the joy and freedom that you don't in dependency. So because Californians have given up freedom, the ability to take care of themselves, to make their own choices, to make the choices of what they're going to do about their health care and other things, then the California elite, the ones who decide, well, we're going to tell you what to do, we're going to take your money from you for taxation, regardless of what you think, they were able to operate and do that. And so here they are, where just by virtue of being an undocumented alien, an undocumented person coming over the border, they have more of a benefit than the native Californian.
Mm.
So, share healthcare. We have three pillars, three foundations we rest upon. Three pillars holding this up, three foundations we rest upon. Medical freedom, financial freedom, and religious freedom. We're wanting to help people find a vehicle to build up those freedom muscles again that have atrophied just by sheer lack of use over these last years, last couple decades, last half century. And medical freedom, okay, you get to go wherever you want to go for your health care. You can, as long as it's a licensed medical professional, you get to choose that person. That licensed medical professional then gets to choose what type of care is right for you. We aren't going to dictate either the patient's decision or the doctor's decision. Financial freedom. Well, it's vastly more affordable than health insurance. Health insurance right now is running about $22,000 a year for a family of four. Share healthcare is running about $4,400 per year for a family of four. Breaking that down monthly for in share healthcare, for a family of four, it's $349 per month. For a couple, it's $249. For a single, it's $149 per month. So you have financial freedom because you now have opened up a large part of your budget for other things that you might choose to do. And religious freedom. Under Medi-Cal and many of the other insurance or government insurance programs, the money that goes into it supports things that God would not be pleased with. Abortion, abortifacient, the gender destruction and deterioration care in many areas, in many states, without the parent's consent if it's for somebody that's a child. Those are things that do not please God. And so we need to have the religious ability, the religious freedom to be able to say, no, I'm not going to be part of that. I'm going to go do something else. So with California still has a individual mandate that everybody has to have insurance. and everybody has to have something, whether it's Medi-Cal or something else. But just as when the federal individual mandate came in, there is an exception for those who are members of HealthCare sharing ministries, which is what Share HealthCare is. A 501c3 ministry that shares in accordance with the members' faith, and the members are all members of the same faith, which in our case is Christianity.
Well, looking at the headlines, one last wave of headlines coming into the new year, and it fits under your category of medical freedom, which you get with Share HealthCare. And that is, for example, here's a headline out of South Carolina. After trying to reach an agreement in 2023, United Healthcare Insurance has cut ties with Prisma Health. The insurance company placed Prisma Health out of network for its members. And the news report talked to one Newberry resident, Gail Wicker, said, "I have a procedure I have to do tomorrow. I might have to pay for it out of pocket," because she was suddenly out of network. In New York, there's this report, Well Now Urgent Care no longer accepted Excelis insurance, which caused many central New Yorkers to stress how they were going to pay for their visits or what care facility they could even go to. In Arkansas, Baptist Health out of network with United Healthcare. Provider and insurer can't agree to a new contract. So all of a sudden, at the start of the new year, because of these contracts and these networks, suddenly people are booted out of network. Well, that'll never happen with Share HealthCare. So talk about this whole concept of medical freedom along the lines of in-network and out-of-network and the advantage of being a member of Share HealthCare.
Just like we don't want socialism, we also don't want oligarchies or monopoly. We want to have choices. That's what freedom is freedom to have many different choices of what to do. So in two of those articles that you read the headline from, United Healthcare was the one that refused to work out an arrangement with the local groups. Well, United Healthcare is definitely part of the oligarchy, and it's a monopoly in some of the regions. And we can just look at what happened with it from before the Affordable Care Act, otherwise known as Obamacare, and what happened with it now. So United Healthcare stock, the price of its shares of stock, went from $33 a share before the Affordable Care Act, before Obamacare, to over $500 per share today.
Wow.
So what is their motivation of why they wouldn't agree with those other entities? It wasn't making them enough money. So Share HealthCare, as I mentioned, is a 501c3. That means it's not a for-profit entity. It's a non-profit entity. It's a non-profit ministry. You know, when you apply to get your 501c3, you have to state what you are. And we're a ministry. And the issue of profit or any of that doesn't apply to us. What does apply is, are we able to share all the medically necessary expenses of our members? Everybody's hearing about how healthcare insurance costs have just risen and risen and risen and risen and risen ever since the Affordable Care Act was passed. Well, Share HealthCare has never raised its monthly rate. Started off at $149, $249, and $349, and that's what we are today. And perhaps next year, maybe the year after, who knows? We don't know what the future is going to hold economically, so maybe we will need to adjust. But we're going to just adjust for what are those costs of the medically necessary medical expenses for our members. Not what is our profit. We need to have more profit. We need to be able to have dividends. We don't do that. And then in terms of cutting off our members' ability to go to certain hospitals because it's not making us enough money, well, that's absurd, and it's absolutely contrary to the idea of any concept of freedom that one has, whether it's free market or anything else. You know, interstate commerce. It's just contrary to any idea that a halfway thinking American has about what freedom is. So we allow our members to go to any licensed medical professional, so a physician assistant, a nurse practitioner, a doctor, of course, an MD doctor, a DO doctor, any licensed medical professional that they choose to anywhere in the world. Of course, if you go outside the United States, let us know ahead of time. Make sure we get the bills in English. Talk to us before you go, because it might be less expensive there for healthcare, and we might be able to help you with your airfare and hotel expenses. But we're trying to increase freedom, and we want people to begin realizing they can exercise their freedom muscles. Medical freedom, financial freedom, religious freedom. That's what Share HealthCare is all about. And it's a tool for an individual, a family, a small business to begin exercising those medical freedom, financial freedom, religious freedom muscles for themselves.
Well, if you're listening and this sounds like a breath of fresh air to you, you can find more information by calling and talking to someone at Share HealthCare. Their toll-free number, 1-844-SHARE-HC. Or you can read all the details for yourself on their website, sharehealthcare.com. That's Mike Sharman with Share HealthCare. And for Wave 94, I'm Doug Apple.